liver, when the liver is already damaged, it is chronic, right? The liver has already been damaged. So that's a chronic one. And we talk about how you can get hepatitis B. We talk about the mode of transmission. We say you can get hepatitis B from body contact. You can get it from fluid. You can get it from blood, right? Someone who is infected with hepatitis B virus, and when they are sweating and you touch the sweat, or they are sweating and they touch a surface of an object, the virus will remain on that surface, and you, the uninfected person, when you touch it, you can get hepatitis B. And we also said you can get it from fluid. Probably someone have an accident and you decide to help in the process, not knowing that person is infected with hepatitis B, or because of that contaminated blood, you can get it. So we say you can get hepatitis B from body contact, from fluid, meaning fluid, right? So we say you can get it from fluid. And we said, if you don't want to get hepatitis, what are those things you can do, which is the prevention? We said you can vaccinate yourself. They have the hepatitis B vaccine that lasts, or that have months between them, like 6 months between each, right? You can vaccinate yourself, or you can use, or the other method, which is the immune hemoglobin. It's a substance from the blood that they will inject in you. It will help to fight against bacteria. If you are allergic to the vaccine, it will give it to you. It will fight against bacteria. And we'll also talk about your hygiene, your personal hygiene. You should learn to wash your hands properly after using the bathroom to stop the spread of hepatitis B. And we said hepatitis can be reactivated, meaning when it is in the acute stage, when it go away, it is possible it can come back, right? So it can be reactivated. Then we talk about who are those people that are at risk of coming down with hepatitis B. We said people who travel from country to country, people who inject themselves, or those who use illegal drugs. You use syringe or needle and use the same thing, and they spread the virus around. So people who have a weak immune system, like HIV, they are at risk of coming down with hepatitis B. Those who have or chronic liver sicknesses, they are prone of having hepatitis B. And then we said, when you have hepatitis B, how will you feel, which is the sign and symptoms? And we say hepatitis, at times when you have it in the acute stage, there is no sign and symptoms. But in the chronic stage, there are some signs and symptoms. It's where you start experiencing a fever, joint pain, or your abdomen start to extend, your stomach. The reason your stomach is extending is because the liver has been inflamed. The liver is swelling. So because it is swelling, it's not in a normal size, it will start to push some of the organs. You see your stomach extending. And the yellowness of your eyes, especially the white part of your eyes, right? The white part of your eyes will start getting yellow. And when you go to the bathroom, your urine will be dark or dark yellow. Because usually the color of the urine is amber, which means light yellow. It's not supposed to be or dark yellow. That gray stool, right? When you go to the bathroom. So we said in the chronic stage is what you will experience. And we said the hepatitis B is caused by the hepatitis B virus. So we said for the complication, this sickness is life-threatening, right? When it is reach the chronic stage. So for the complication, or for the treatment, the treatment, your doctor will put you on some antiviral drugs, or they will tell you to observe your diet. You will be restricted to certain diet. You will not take in certain food. And when the liver is completely damaged, you will need a liver transplant. Or when you have a liver failure, you will need a liver transplant. So That's all we said about last week. So if you are not following I mean, or if you are not watching, at least you know a little bit about hepatitis B, right? So we'll take a short break. When we come back, I'm going to be telling you all you need to know about hepatitis A. Hello guys, welcome to the program, The Healthy Way, the show that talks about your well-being. I am your host, Shiba H. Bade. I'm so excited to bring you the latest and most important news on national and international health issues. This program is dedicated to providing you with critical information you need to lead a healthier lifestyle. We also offer valuable tips on how to stay in shape and maintain a healthy lifestyle. We offer valuable tips on how to stay in shape and maintain a good health care. We also showcase success stories of those who have overcome health challenges. Join us every week as we explore the world of health and wellness on the Buzz TV Sakon Channel 4. It's time to start your journey the healthy way. Hello guys, welcome to the program The Healthy Way, the show that talks about your well-being. I am your host, Shiba H. Bade. I'm so excited to bring you the latest and most important news on national and international health issues. This program is dedicated. Welcome back to The Healthy Way on Buzz TV. So before we went for our break, I told you we're going to be talking about the hepatitis A. So we'll start by looking at the definition of hepatitis A. Hepatitis A are the most highly contagious liver sickness and in short term. Hepatitis A is a liver sickness too as well. But when they say it is highly contagious, meaning there are a lot of people that can get it, right? People can get it. It is common, highly contagious. When they say contagious, from person to person, you can get it, right? The way in which people can get it. And hepatitis A is a short-term liver disease. When we say short-term liver disease, is acute, meaning this sickness, when it start happening to you, you will not have signs and symptoms, but the body can fight the virus on its own and it will go away. Probably the sickness can last from 2 weeks to 6 months. So hepatitis A can go away on its own. And the hepatitis A is caused by the hepatitis A virus. When the virus attacks the viral tissues and the tissues start getting swollen up, then you can come down with hepatitis A. But there are few people who usually have chronic symptoms. Hepatitis, it is real. It is very hard for you to see people are down with hepatitis A. It is very hard, but it's life-threatening, but it's hard. So we have this sickness. This sickness is very common. When we say common, it means it is almost in every part of the world. Something that is common, you can see it anywhere or everywhere, right? So like in the USA, the United States, the Center for Disease Control in 2018, when I was doing my research, they said 4,474 cases of the hepatitis A virus. The ones that were diagnosed, meaning people that went to the hospital, they did a test and they were diagnosed. They told them you have this virus. So just imagine people who went to the hospital, then the one who came in contact, they didn't go to the hospital. So you see how common this sickness is, and it is widespread, right? So since 2018, the sickness keep increasing, the virus keep increasing, hepatitis A. The reason it keep increasing is because the way in which it spread, the way in which people get it. So how you can get hepatitis A? You can get hepatitis A from an infected person, from the stool or the blood of an infected person. Like, okay, I have hepatitis A, right? Let me see. And I went to the bathroom. I used the bathroom. I didn't clean myself properly. And the virus left on my hand. I came and I touched or the surface of an object, or I touched something. Someone who is not infected, or my colleague came and touched that same surface, the virus will leave on his or her hand. And if you put it in your mouth, the virus will enter your mouth, and then it will start, you will get infected. I mean, when the virus enters your mouth. So you can get it from person to person. And you can also get it from contaminated food or contaminated water. When we say contaminated food or contaminated water, somebody who have this virus and touch of food and the virus leave on the food, or the touch of water and the virus leave on a water, so you can get it, and you can get it that way. So you like for the production house, sometimes you use a bathroom. People who are processing food, sometimes you can even get it from harvesting. Sometimes when you're harvesting food, you just grab it, you eat, right? So you can get hepatitis A from person to person, someone who is already infected, and you can get it from contaminated food or water, right? So that's how you can get hepatitis A. And who are those people that are high risks of getting hepatitis A? Meaning, or what are those things you can do that will make you, or that something that make you exposed, or something that make it possible for you to get this sickness? Or people who travel, like I said for the B, the same thing. People who travel from country to country, it could be local, it could be international. So if you are traveling, probably the person sweating, they are infected with the hepatitis A virus. You don't know, you sit by them, either in a taxi, on a bike, or whatsoever, you can get the virus. And people who usually inject themselves, people who use illegal drugs, like we can say the drugs men, right? The drugs men, they can use, or the needle, the syringes, because they don't have time to change needle or whatsoever. Or I'm juke myself, the other guy grab it, juke himself. Everybody just spraying it. And people who do same sex, right? People who have sex with their friend men, or women who have sex with their friend women, or people, you can get it through. It is possible you get it through sex, right? And based on your occupation, meaning the work you do, like we the nurses or the doctors or health workers, we are at high rates of getting hepatitis or hepatitis A, right? Like for the lab or technicians, the laboratory technician, right? People who work in the lab that play with specimens, that play with blood, they are at high rates, because you want to test that person if they have this sickness. And while collecting that specimen or that blood or whatsoever, the little mistake you made, you are going to get infected. And with the nurses, you are giving a patient an injection, and while trying to recap, meaning you want to put the rubber back on the needle, you could mistakenly prick yourself with that needle. And while you're taking care of the client too, they could mistakenly vomit on you, and you know it's a fluid. You could get it. So health workers are at high risks. So it's always good that you take precaution as a health workers, right? And people who have a weak immune system, like people who have HIV, they are at high risk of getting hepatitis A. And people who have or chronic liver disease, you already have certain disease, you suffer from liver disease, the hepatitis A, or when you have a chronic liver disease, it is possible that you get hepatitis A, right? So those people who are engaged in these things are at high risk of getting hepatitis A. Then we have the signs and symptoms. If you have hepatitis A, how will you feel to know that you have this sickness? Because we said this sickness is a short-term sickness. For the symptoms, some people, they cannot express any signs and symptoms. And for this virus, it can be in you and you be spraying it to other people without it showing any signs and symptoms, meaning you can feel anything that you sick, your doctor or your nurse will not feel anything that you sick, right? So the common way in Liberia when you are not, when most people, when they are not sick, the chronic stage of sickness is they cannot go to the hospital. So how will you know that person is infected? So that's why the sickness is common and it's life-threatening. So that makes sure we take precaution. So the signs and symptoms, if you may likely experience the signs and symptoms, you experience or loss of appetite, you don't want to eat, fatigue, you feel that tiredness, dizziness, right? You feel tired and you feel nauseated, your stomach is upset, you have that urge of vomiting, but you cannot vomit, right? And sometimes you feel weak. So these are some of the signs, some of the symptoms you feel if you may likely experience it, right? So now we talk about the signs, symptoms, the prevention, the mode of transmission, meaning how you can get it, and we know the definition now, right? So we will take a short break. When we come back, I'm going to be telling you how you can prevent yourself and those basic treatments that are recommended. Hello guys, welcome to the program, The Healthy Way, the show that talks about your well-being. I am your host, Shiba H. Bade. I'm so excited to bring you the latest and most important news on national and international health issues. This program is dedicated to providing you with critical information you need to lead a healthier lifestyle. We also offer valuable tips on how to stay in shape and maintain a healthy lifestyle. We offer valuable tips on how to stay in shape and maintain a good health care. We also showcase success stories of those who have overcome health challenges. Join us every week as we explore the world of health and wellness on the Buzz TV Sakon Channel 4. It's time to start your journey the healthy way. Hello guys, welcome to the program The Healthy Way, the show that talks about your well-being. I am your host, Shiba H. Bade. I'm so excited to bring you the latest and most important news on national and international health issues. Welcome from the break. This is The Healthy Way on Buzz TV, and I'm Shiba H. Bade. So before we went for our break, we talked about the signs, symptoms. Now we're about to talk about the diagnosis. What your doctor will see, or what your doctor or your nurse will do to know that you have hepatitis A. So when you go to the hospital or the clinic, question, they get angry, right? They get upset with you, but it's necessary. The reason we do that, I want to collect some data, I want to get some information. So because every sickness has a sign and symptoms, or there are certain way you will feel for us to know that this is the particular sickness, which is the impression, right? They will carry on the laboratory investigation now. The lab will tell, oh, this is a particular virus that is causing the sickness. So from your discussion, from the question the doctor will ask you, why you will say, why you will tell your nurse, or your doctor, or that's how you will know that you are infected with the hepatitis A virus. And you will do a laboratory investigation by taking your blood and putting it under the microscope to see if you have that particular virus that can cause the hepatitis A, right? The hepatitis A virus. And when you do that, when you know you have hepatitis virus, he will tell you what to do, right? So now if you don't want to get it, if you don't want to get a hepatitis A, which is the prevention, what are those things you need to do? The first recommendation from WHO, from the Center for Disease Control, or they say is the vaccine. You vaccinate, you test yourself, you do your test. If you are negative, then you go for your vaccine. And the vaccine is 6 months apart. So we have the single dose for the hepatitis A. And the vaccine, just how the hepatitis, that's how they have their own vaccine. So if you have hepatitis A, you're going to take hepatitis A vaccine. Except for the A and the B, because they have a combined one. Because the A and the B is the most common and life-threatening one. So they went and combined or the vaccine for that. So for the single dose, you're going to take it 2 times, right? 6 months apart. So if you take it 6 months, another 6 months, you're going to take 2 dosage. Then for the combined, you're going to take it 3 times. But it's the same 6 months apart. It carries for a longer time. So the vaccine is the best way to prevent yourself. And learn to do hand hygiene. Wash your hands always. Always learn to wash your hands. Like for the health workers, I will advise you always wear gloves. When you are taking care of a patient, wear your glove, because some sicknesses are asymptomatic, meaning they don't show signs and symptoms. So wear your gloves, wear your PPE. If you read this person or chat and you know they have hepatitis A or B, whatsoever it may be, right? Diseases that are contagious, always make sure you protect yourself, because from the hospital you are going home and you have your family, one person can destroy a whole family. So it's always good that you prevent yourself. Prevention is better than cure. So you use the vaccine, and the vaccine, it is given, or 2 years to 11 years can take it. The hepatitis A vaccine, 2 years to 11 years can take it. And elderly people too can take it, right? So when you are infected already, can you take the vaccine? No, you cannot take the vaccine. When you, let's come in contact with a hepatitis A patient, then I can say, or you are taking care of the patient and you mistakenly prick yourself, you can already go to the vaccine center and you take the vaccine, it will help you. But while you are infected almost close to a month, when you take the vaccine, it won't help you. So besides the vaccine, we have, because there are some people who are allergic to the vaccine, meaning they cannot take it, life-threatening allergic. When they take it, some of them, or they will have rashes coming on their skin. Some of them will make them feel miserable. Some of them, they will become unconscious. So WHO brought another method. It brought the immune or hemoglobin. It's a substance from the blood. They will inject you with it. It helps to fight against bacteria or viruses too. So this one, that are the hemoglobin, globulin lasts for a short time. The vaccine lasts for, it carry for a very long time. So for people who can travel and you are allergic to the vaccine, you can take the immune globulin. So it is recommended. After that, learn to wash your hand properly and keep yourself safe. Then we come to the treatment. And does hepatitis A has a treatment? No, there is no specific treatment for hepatitis A. The only thing, if you are infected and you go to the hospital, because the body can fight this virus on its own, your healthcare provider will tell you you need a rest. Stay home and rest, right? You need a bed rest. Probably they will keep you in the hospital while you are resting, and you need enough food. You need enough nutrients. When you are experiencing the signs and symptoms, you will not be able to eat. So when you are not eating, it is advisable you take in some snacks and drink enough milk and take in food that has enough calories. It will keep you up. Drink enough milk than water, right? So hepatitis A don't have a specific treatment. It's only taking care of yourself at home, eating enough food and preventing yourself. That's all. That's the treatment for hepatitis A. So let us learn to take precaution, because you know prevention is better than cure. If you traveler, make sure you take your vaccine. Before you put any food in your mouth, make sure you wash it. Always learn to wash your hands. Personal hygiene. You see, I have my wash your hands or don't want to cook food. Make sure you straight. Have hepatitis A and I'm working at the food industry. You don't know if my hands are contaminated. If I have that virus on my hand and I touch the food, you are not seeing it. And the moment you grab it, some people, because the food or the freezer or as bad, they will take it and start eating it. No, it's not good, right? So wow, it's so sad when I was doing my research, like hepatitis A. So when your water is not purified, make sure you boil it, or you can put it in the fridge and they take out the ice from there. You defrost it, then you can drink it, right? So always make sure you take prevention. Keep yourself healthy and remember your hygiene. So this is how we come to the end of our discussion, and stay healthy. Hello, guys. Welcome to the program, The Healthy Way, the show that talks